So
Mm.
I'm certainly very curious in my other hat at CDA, as we see more and more single arm data come, there's going to be the need for both sponsor and the community to understand what comparative effectiveness looks like. But maybe just as we think through trying to help, and there might be some trainees and students listening to this as well, you mentioned databases. So let's get a little bit granular maybe. And I realize that real world data can kind of mean anything that's not in a trial, but if you were to think about the databases out there, whether it's Canada or nationally, and you mentioned the term administrative data sets, but can you take us through a few of the heavy hitters, the common ones we might expect to see in these abstracts? And if you notice any differences between them, I realize that there's a lot out there, but maybe just some of the top ones that you think are really high profile.
So the common ones I tap into, again, in Canada, I think we're quite fortunate in the fact that in most jurisdictions, there is a cancer registry. And most cancer registries are very robust and very comprehensive. And essentially, anybody who's diagnosed with cancer would be captured in this registry. So in most of my projects, that's oftentimes a starting point. So if we want to do a bladder cancer project, for example, we'll tap the cancer registry to give us a list of all the individuals with bladder cancer. In the registry, it also contains information such as staging information, sometimes grade, and in some cases, there's also some initial treatment information. So did it get surgery? Did it get chemotherapy? So that is a good sort of entry point to do a study. In many provinces, we also have a pretty robust pharmacy data. So whenever a drug is dispensed, whether it's IV or oral, it's flagged in the pharmacy data. So as a medical oncologist, I look at chemotherapy use a lot. So that is also one I would leverage quite a bit.